Hi, I'm Dr. Rangi. I'm an endocrinologist and I practice in Sacramento, California. I want to discuss a topic today that is very important that I see in my practice every day. It's osteoporosis. Osteoporosis leads to fractures that could be prevented. It is estimated that there are about 8.9 million fractures that happen worldwide every year because of osteoporosis. That means there's a fracture that is happening every 3 seconds in the world. It is estimated that 1 in 3 women and 1 in 5 men above the age of 50 are expected to have fractures in their lifetime. The overall estimated risk of fracture in one's lifetime is close to 40%, which is very similar to a cardiovascular risk. Therefore, this is not a condition that we should be underestimating or not addressing. This has a huge implication, both personnel and economic burden on the countries and on the world. Now, what is osteoporosis? How do we define osteoporosis? Osteoporosis is a condition where we have microarchitectural deterioration of the bone, giving a very fragile look to the bones, and that increases the risk of fracture if there's a minor fall. In other words, in simple words, osteoporosis is thinning of the bones, and there are a lot of factors that affect this thinning of the bones. Let's try to understand, why do bones get thin and how are the bones maintained? Bones are the living structure in our body, and they're always recycling or remodeling. This is very similar to how you don't see your skin renewing, the same way your bone is always renewing. So there are cells that make new bone called osteoblasts, and there are cells that eat up the old bone called osteoclasts. This osteoblast and osteoclastic activity is a very coupled process in the beginning, where we have equal amount of formation and renewal. Until age 30, we have peak bone mass, and after age 30, we start losing more bone and forming less bone. There are certain factors that can make things worse at that point. Either you're coming in with a low peak bone mass from the past, then you have more drop in the bone loss later on. Or if you had a good peak bone mass, then certain habits or medications or certain conditions can increase your bone loss in the future. So let's look at some of those features. People who don't have a good dairy intake or a dietary calcium intake are at a high risk for bone loss. People who don't take adequate amount of vitamin D are at a high risk of bone loss. There's some personal factors that can influence bone loss as well, including smoking, excessive alcohol use, not exercising, or sedentary lifestyle. So it's very important for us to have a healthy lifestyle, exercise regularly, which can help prevent falls and also improve your muscle strength. Same goes with vitamin D. Vitamin D deficiency increases the risk of falls and increases the risk of fractures. Calcium can be taken by calcium in the calcium-rich food in the diet, but vitamin D usually requires a supplementation as in the form of a pill, unless you're taking fortified milk or orange juice or salmon or certain products that are rich in calcium, including egg and vitamin D, including egg yolk. Now, what are the other factors that affect the calcium in the bone or in the bone remodeling? One of the important factors is glucocorticoids or steroids. Steroids are given to people who have some kind of inflammatory condition underlying. It could be because of rheumatoid arthritis, it could be because of Crohn's disease or certain conditions. Anybody who's getting glucocorticoids or prednisone more than 5 milligrams a day is at a high risk for bone loss. Somebody getting aromatase inhibitors because of history of breast cancer. Anybody who's getting heparin as a blood thinner, anti-seizure medications. All these medications can increase your risk of bone loss. Now, what can we do to prevent this bone loss? If somebody is having early menopause, then giving them hormone replacement therapy until they were expected to have a natural menopause, that helps them keep the bones more healthy. However, giving the hormone replacement therapy is very person dependent and your risk dependent, so discuss with your doctor if that's a good option for you. We do not give hormone replacement therapy for women who are postmenopausal in their 60s and 70s just for bone prevention. Unless you've been given that for other reasons, then you may be benefiting your bone health as well. Now, what are the other things we can do to prevent bone loss? In addition to calcium supplementation, vitamin D supplementation, keeping adequate amount of vitamin D, and preventing or avoiding falls, and avoiding medications that can lead to bone loss, sometimes we have to treat patients who have osteoporosis. So that brings me to the question of how do we diagnose osteoporosis? People who have a previous history of fragility fractures, anybody who had a minor fall from a standing height and had a fracture, are at much higher risk for second fracture or secondary fractures. So those are the people we definitely want to target and treat them independent of their bone density. Otherwise, it is recommended that women above the age of 65 and men above the age of 70 get a bone density screening, and if they are low on their bone density, then they should repeat the bone density every 2 years to monitor. We should definitely treat people who have had previous history of fragility fractures to prevent next fracture. So what are the treatment options? There are various medications available. There's some oral therapy or given by mouth. Others are given as an injection. All different options could be available for you. However, you need to discuss with your doctor what is the best option for you. Most of these medications decrease the fracture risk by about 40 to 60% or more. However, there's no medication out there that prevents every fracture. So what you can do is make sure you take active role in your activity and exercise regularly, prevent falls, take calcium, vitamin D, do not smoke, do not have excessive alcohol, and take the medication that's prescribed to you. These could be medications that are taken every day as an injection, but those are usually followed by other medications to preserve your bone mass. I hope this was an educational video and helped you understand what osteoporosis is and how do we prevent it and treat it. If you have any questions, feel free to call us. Our number is 530-677-0700. Thank you so much. Good luck.